This medication is amlodipine. Drug classification: anti-anginal calcium channel blocker. The action of amlodipine is to decrease or inhibit the influx of calcium ions across the cell membrane during depolarization. It also relaxes smooth muscles and arteries to increase blood flow and to decrease O2 demand. It is used for angina as well as hypertension. Although it's used for hypertension, it is not classified as an antihypertensive medication. This medication is contraindicated in patients with severe aortic stenosis as well as severe coronary artery disease. This medication does contain dihydropyridine, so if anyone has any allergies to those medications or that ingredient, you are going to need to avoid this medication. This medication is a Category C medication and should be used with caution in pregnant women and lactating mothers. This medication should be used with caution in patients who are geriatric patients or liver function issues. The safe dose for this medication is 5 to 10 milligrams. It's not usually prescribed greater than 10 milligrams. I've never seen it. I've never prescribed it. And I've also seen it used in 2.5 milligrams, which is a low dose. One common side effect of this medication is edema, lower extremity swelling. Sometimes people might have puffiness in their face or signs of increased fluid. So you want to make sure that the patient weighs himself daily and also look for signs and symptoms of fluid retention, such as listening to lung sounds for crackles, checking urine output, as well as making sure that you look at the lower extremities. Other side effects could be cough, it could be weight gain, lightheadedness, dizziness, syncope, palpitations, rash potentially. If I haven't said cough could be one of them. It also could cause epistaxis or nosebleed. There's just a variety of other symptoms or side effects that can develop from this medication. So you always want to be aware, but keep in mind that you have to be always considering the benefits outweighing the risks of this medication. Nursing students, you also want to make sure that you monitor lab values. These lab values are going to include the CBC, liver function studies. You also have to make sure that you reassess vital signs. You also want to make sure that you educate your patient about this medication. They should not be drinking alcohol or grapefruit juice while they are using this medication. They should also contact their healthcare provider if they have any concerns about this medication. They should not double dose if they miss this medication because overdose symptoms can be detrimental. Also, diet. Diet is always a big issue. Even though we administer medications, we should always be educating the patients about diet change, decreasing sodium, high fat, high cholesterol diet. We also want to teach the patient about operating machinery such as driving or cooking or anything that could be hazardous because this medication can cause dizziness and lightheadedness. The outcome use of this medication is decreased blood pressure as well as no or decreased angina symptoms.